Okay. Good evening, everyone. It is now 6 p.m. Welcome, everyone, to our event, Health Alumni, the Path from Degree to Career. Thank you so much to our attendees and to our panelists. We have about 20 attendees here on the line right now for participating today. Let's go ahead and get started. If you cannot hear me, please go ahead and raise your hand. Okay, so there are some guidelines and important information for this evening's event. First, please make sure that your mic is muted and that your video is off. If you can see my screen, but you cannot hear me, please try by calling in to the WebEx number listed on the slide. If you happen to have any technical issues throughout the event, please go ahead and private message me through the chat function. My name is Caroline Ramirez. Also, please note that we are recording the event. Okay. We'll move along. Every student here on the event will have plenty of time to ask some questions. When we do have questions, please submit them through the chat box. It is very important that you select to all participants in the chat box. If not, then we cannot see your question. Okay, it should already be the default in your chat box, but if not, just make sure you click on the drop down and select to all participants. This is different than to all panelists. Okay. If you have a question for a particular panelist, let's say, for example, to Joanne, please just write in your text box to Joanne and then continue on with your question. Okay. If you would like to ask a question and use your own audio, please use the raise your hand function, and then I can unmute you, and then you can ask via audio. In the next slide are screenshots of how you can access those different functionalities. Okay, so the chat box should already be open for all of our attendees. If you do lose it though, or disable it, just hover over the bottom of your screen, and you'll see those little bubbles come through. Make sure you click the blue bubble with the little speech bubble. Okay, that'll open the chat box, and you should already have to all participants pre-selected, but if not, just make sure you select that. Okay. And then you can type your questions in the chat. And then for the raise your hand function, if you look, it'll be under participants. On the bottom right-hand side, there should be a little hand icon. So if you want to raise your hand, it'll be done right there. Okay. I'm gonna stop sharing. All right, so now that we've covered technology, I want to quickly introduce myself. My name is Caroline Ramirez. I'm the Health and Science Industry Advisor at University Career Services here at Mason. I support students in their career development, and I also work with employers who are looking to connect with Mason students, which is how we have this Health and Science Industry Week this year. And I am super excited about this event that we have today. Each panelist really brings a great background in health. So make sure to ask your questions when we get to the Q&A portion of our event. So without further ado, I'd like to begin introducing our panelists. To panelists, please, let's introduce yourselves with name, role, where you work, and your degree background. So bachelor's, master's, those degrees. And let's start with, we're going to alphabetical here. Let's start with Christine.
Hi, my name is Christine Koehmstedt. My role is a senior health systems analyst at Mitre Corporation, which is a nonprofit, and FFRDC, so Federally Funded Research and Development Center. I have a master's in public health from the Global and Community Health Department, and yeah, so I'm class of 2018 for my master's.
Thank you, Christine. Next up on the line is Chris.
Hello, everyone. My name is Christopher Miller. I am currently serving in the role of Electrophysiology Program Manager at Virginia Heart, and I have a bachelor's degree in nursing, class of 2015.
Thanks, Chris. Now up is Cordelia.
Good evening, everyone. I graduated from George Mason in 2014 with my bachelor's in social work, and I graduated in 2015 through the advanced standing social work program at the University of Maryland with a master's in social work. And I'm currently a LifeSet specialist at DC Child and Family Services, where I work with youth who are aging out of the foster care system.
Beautiful. Thank you, Cordelia. And then to our final panelist, last but not least, Joanne.
Thank you. I'm Dr. Joanne Lagin. I was at George Mason University for my master's in nursing administration and my PhD in nursing administration. We left the East Coast in 2000, and I've been on faculty at St. Louis University School of Nursing since 2000. I am the former associate dean in the School of Nursing. Currently, I'm a full professor, and I teach disaster preparedness. I'm working on my fourth textbook at this time, and the second one in disaster preparedness. But I teach online and on-site graduate, PhD students, and undergraduate students.
Thank you, Joanne. Super relevant things happening right now. All right, so now I'm going to hand it over to today's moderator of our panel, and that is Kelly Beckwith.
Hi, everyone. My name is Kelly Beckwith. As Caroline said, I am the Master of Public Health Program Coordinator in the Department of Global and Community Health at Mason, and I'm very happy to moderate today. So let's get started. So there's one thing that's on everyone's minds right now, and that is the coronavirus. And since it is at the forefront of health, and we have these great panelists here, we thought we would ask some coronavirus questions to kick it off. So Cordelia, can you tell us how COVID-19 is affecting or altering recruitment strategies and hiring timelines at your workplace? Cordelia, you need to unmute yourself.
Okay, can you all hear me now?
Yep.
Awesome. Thank you for that question. We are still moving along as usual because we are a DC Child and Family Services agency of the District of Columbia. We are an essential agency that is remaining operational. Majority of the employers are on situational telework, so we're working from home. I am, in my particular role, I'm still FaceTiming with my youth. I'm having phone calls with them, conference calls, meetings, and things of that nature. So everything is moving along, just more in a more virtual nature. Whereas like our CPS workers, the people on the ground, the first responders, they are active in the field in answering abuse and neglect calls. And so in terms of us hiring and still employing social workers, that is something that our agency is still doing and moving forward.
That's fabulous. But those types of needs never take a break.
Yes, and some things that we are often seeing right now is, especially with school not in session, the calls to the hotline are not as frequent. So we're just doing our best to ensure that we're keeping children and families safe in the district.
Great, thank you. So Christine, has hiring and recruitment also been affected at Mitre due to the pandemic?
So can you guys hear me?
Mm-hmm.
Okay. Yes. So at the moment, from our leadership, they have said that we probably will be a little bit of a slowdown, but that was last week, and based on this week, we work for government sponsors, and they've they really are requesting a lot of work, so I don't see that being something that really sustains, I think, there might just be a little bit of a slowdown and then it'll just pick right back up. So
you both work in fields that are supporting very different aims, but similar things related to the pandemic.
exactly.
Christopher, what route recommendations do you have to students on how to make themselves marketable during this time of social distancing?
So I thought this was actually one of the tougher questions that would be presented, because obviously this is a very new format for everybody at this stage. So I talked to one of the recruiters at Virginia Hart, and obviously these are very unprecedented times for recruitment. So I said, look, if you're looking for candidates right now, what are some things that you would say to them to get themselves out there? And he really brought up 3 topics. One of which was get as much experience as you can now. And it doesn't necessarily mean it's going to be in the field, but there's a lot of virtual opportunities out there, such as this. And a lot of companies are offering educational opportunities online, Zooms, FaceTime events, stuff like that. And that on a resume shows a lot of drive and personal initiative and looks really good. Another thing is to network. Obviously, this is a good networking opportunity, but a really active LinkedIn account to getting to know people and getting it out there that you're interested in opportunities. And then another one, which I thought was really good, is practice getting comfortable with interviewing questions. And that's not just, you come up with your own, but actually see if you can find someone, even during like an event like this, to ask those difficult questions and get ready to be able to be prepared to answer them.
Thanks. A lot of the things that you said are things that University Career Services offers to students on campus and virtually now. So thank you very much.
Of course.
Joanne, what advice do you have to students who are conducting a job search during this time?
Well, we at the university, we have an uptick in applications for nursing because we can almost guarantee they're going to get a job. Right now, our nation is under siege. And so we're asking for nurses, retired, out of practice, whatever, get back into it right now. So for people now, this is the time to get into it. Nursing was my second career. So I was a teacher before that. And we all know that nursing is 95% teaching. So if they have an interest in nursing, go for it. It's a tough curriculum, but go for it because you will get a job. And what else was the next part that you asked?
Just what advice do you have to students who are conducting a job search during this time?
They really are in the driver's seat, and we tell our students to get a spreadsheet. And when they're looking for employment, look at the mission and philosophy of their potential employer to see if what their goals are, the mission and philosophy of that agency matches their own. If they have some strong religious or ethical convictions, to make sure that they look at that agency and see if it's a match with their own, and then see what sign-on bonuses there are. Many of them have tuition remission, and look to see how long they have to work to get that tuition remission. And many times, if they are completing their BSN, their new employer will pay for them to get their master's and even sometimes doctorate.
Great, thank you. Yes, nursing has some sign-on bonuses that not all in public health do.
Exactly.
So that's fabulous. Does anyone else want to answer that question with advice for students conducting a job search during this time?
If you don't mind, I could say something.
Please.
So the market right now is wide open, just like Joanne had said, and you're basically in the driver's seat, especially going into anything in healthcare. There are, to Joanne's point again, I have already seen advertisements for up to $60,000 sign-on bonuses because the U.S. is at such a negative deficit with people to take care of people in our aging population. So it's, again, I always told my classmates, networking is the most important thing you can do. And I say that because the person who you do a class with may be the person interviewing you in the future, or the person that you do a clinical assignment with may want to hire you straight out of school. So really take those opportunities to do that networking and build that network system, and it will pay off in the end.
And to add to your point, Chris, in terms of networking, don't be afraid during this time to schedule a phone call with someone, a Zoom conference call, or a FaceTime with someone that you may have wanted to get coffee with or meet and just pick their brain. People love talking about themselves, and when you approach someone to ask about what they do, how they got to where they are, and if you can just pick their brain, they love that. And so don't be afraid to do that virtually during this time.
Yeah, can I build on that as well, Kelly?
Please.
Yeah, and I'll just echo what everyone else said. You know, all of us were happy to volunteer to be here tonight, and so I'm sure many others would be willing to sit down with you. And like what Kelly said, take advantage of the career services available at George Mason. They are definitely top notch, and just practice interviewing with friends in like the structure that agencies are generally going with these days, and that's kind of like your behavior and like the outcome of the situation or whatever. So I feel like just practice with your friends if you can.
Thanks, Christine. All right, well, those are actually all of my questions for today, and we really want to open this up for the students on the line to ask questions of our panelists. So if you have a question, remember to type it in the chat box and send it to all participants, which is the default. Or if you want to ask a question vocally, raise your hand and Caroline will unmute you.
Okay, so it looks like Linda has just raised her hand, and I will unmute.
Hi, thank you. What an interesting panel. I wasn't expecting such a nice variety, but so I'm just finishing my PhD. I'm 60 years old. I went back to school 10 years ago, and I defend my dissertation tomorrow, so it's in the bag. But so I've studied neuroscience, aging brain health, and music as medicine. I was a professional musician for many years, and came back and have really had quite a journey. So I'm in kind of a niche. And so aging brain health, prescription iPods. I have a master's in health science from Hopkins, a master's in neuroscience from Mason, and I'm finishing my PhD in health communication. So it's a whole new kind of field, and aging health physiology is the nurses understand physiology is the mediating factor in using prescription music as medicine for pain, and normalizing dementia patients and normalizing children with autism. It really has a great power, so I wield that power. So it's and I have about $400,000 in student loans. It's been expensive doing this, but I've done it, and I'm ready. But the point, I need a placement, either a postdoc or a job. And how to find my fit, especially in light of this current crisis, which I work with a transition metals lab with Jane Flynn. She's one of my advisors, and she studies zinc and I study manganese. So I study oxygenation. So I'm trying to do some side work on this coronavirus triage using manganese to, deal with the systemic breakdown while the lungs are being flooded, give the lungs a break and let manganese do some work and systemically. So, I'm a kind of a scientist and musician, but I mean, there's no real niche in the field. So I'm, I just started come in and introduce myself, and hopefully find the right placement because I'm getting my PhD probably tomorrow at noon. Thank you.
Thanks, Lindy.
Congratulations.
Yes, congratulations.
What I hear you say, your niche would be, I believe, best used at a health science center on a university campus. I
Yes,
think that's where you ought to apply because especially if it's an academic health science center, you're going to have scientists, you're going to have healthcare providers and associated healthcare agencies. And that music is very valuable to all age groups. So I think that would be a great fit.
Awesome. What's your email address? Can I contact you for some suggestions? That would be tremendous.
I'm in the Midwest, but I can certainly share that with you or anyone who's interested. It's Joanne, Joanne .Langan, LANGAN at SLU.edu. I'm at St. Louis University, and yes, we have a health science center.
Awesome. Awesome. That's a great suggestion, and I look forward to emailing you and maybe following up. Thank you for your response.
So following up on Linda's question, sort of broadening it a little bit, you know, everyone graduating from a degree, whether it be a bachelor's degree to a PhD, how did you all as panelists find that niche that really made you excited and figure out what you really wanted to do for your career?
So with me, I knew that nursing was something that I wanted to do. And I knew, having a military background, I wanted to do something more fast paced. So I initially started out in emergency medicine, and I worked at GW in the emergency department there. I did that for a little while, and ultimately where I wanted to end up was in the trauma intensive care unit at Inova Fairfax Hospital. At the time of application and graduation, they were not hiring new grads. However, again, networking, I cannot stress this enough. Through one of my professors, one of her former students worked in that unit. And I was able to network to him, and I actually got to shadow with him for a full 12-hour shift, which meant I got to meet the clinical director. And 18 months later, after I had graduated and was working at GW, he was no longer the clinical director, but a position became open. He reached back to me, knew that I was interested, and I interviewed and I got the position. And it really, really, really is all about who you know. And especially in nursing, it's such a small community, even though there's hundreds of thousands of nurses. I work with people who I know worked on the East Coast and the West Coast and internationally. So again, I can't stress the networking enough, but you know, it's nursing. I think you find out really early on what you want to do. I made my transition to work at Virginia Heart because it was a better quality of life for me. So I get to see my family instead of working all nights. But ultimately I was able to get, you know, my dream job right out of the gate because, you know, I made those connections.
Great, thanks.
And looks like we have a couple of hands raised here. So first I saw Regina had her hand raised, so I am going to unmute.
Hi, I am moving to Texas this summer to join my husband who has already moved there. And geobatching is not something I'd like to continue any longer than I absolutely have to. But networking is proving to be challenging for the 2,300 mile difference. And I was wondering if you had any suggestions. I am looking into what I would ideally like to do is to make policy and help. It's going to be in Austin, the state with their directives, with the homeless issues that they have, as well as the hunger issues that they have. I'm sorry, and I'm finishing my MPH in community health promotion next month.
So does anyone have any advice on long distance networking?
I was at George Mason University teaching, and I was working at Inova Fairfax Hospital in transplant. And I knew that we were moving to the Midwest, and I did not have a position. So I did my homework and I looked up the universities that were in the Midwest, especially in the St. Louis area. And I started to send query letters to those deans of nursing in St. Louis where I knew we were relocating. So you kind of reach out, send those query letters, ask if they, or you can even send your curriculum vitae or your resume to them and say, would you be able to have a phone interview, Zoom interview? You have to put yourself out there, but you have to do the homework and find out what those areas are where you're interested. If you're interested in policy, you need to look up that government structure and see who might be doing some grassroots level work in your area of interest. Contact them. They're public service people. They're going to be available to you.
Excellent. Thank you.
Thanks. All right, so we have a text question here. With healthcare being such a diverse field, how did you decide to pursue the positions you're in? Christine, do you want to take that one?
You said with healthcare being such a diverse field.
Mm-hmm.
Yeah, I don't have a specific niche either, and I still don't, and I kind of am hoping to hold on to that. And so some people will say, you got to pick something, and then, other people will say, it's good to be a generalist. So I just picked something that was most fascinating to me because it seemed like, people who were advising me were like, pick what's the most challenging thing, Kelly. Pick what scares you. Yeah, so, I've gotten to work on children's health insurance program, and that was really fun for me, and I learned a lot. It was a little bit outside the public health realm, but not really. And health system stuff is really challenging, and a lot of my classmates really actually didn't enjoy that class very much, but I was like, sign me up. So it's just kind of, just go with what excites you and challenges you at the same time. And to the previous question, I would also say one thing I did, I applied to so it took me about 6 months to find a full-time permanent position, and I think I applied to somewhere around 60 jobs. So I similarly also kept an Excel spreadsheet to keep track and follow up and such. So last thing I would say is sign up for alerts and try and apply within the first 24 hours. It's kind of daunting, but just go for it. All right, thanks.
That's great advice.
Thanks, Christine. Okay, so another question here is a question for Cordelia. What licensing do you recommend for an aspiring child and family social worker? You might be muted.
I'm muted. There I go. So licensing is different across the board depending on which state you're applying in. For the District of Columbia, they do require you to have a license right after your master's program, which is a licensed graduate social worker. I know in Virginia, you're not required to have a master's license. And then after you're working in the field and you get your 3,000 hours and you get your 300 supervision hours, you can apply to be an independent clinical social worker. So you can just go online to find out whatever state you're looking to apply for a job in and look at their requirements for licensures. And once you pass your exam, you can transfer those scores to a different state as well and follow their steps and protocols to be licensed in dually licensed in other states as well.
Helpful, thanks. Okay, this is a question that says, as a community health major, what job posting would we look for to apply?
So I had a friend who was a community health major, and he kind of ran into the same question. He actually found it easy to get into like local government and policy. So you can literally start at, like the county level, and the public health need, especially in this region, is insane. So there's always opportunities. I would start at the local level and kind of work my way up. But he was, I would say, within 2 weeks of graduation, he was able to secure a position.
Yeah, community health is such a broad major that students can go in so many different directions: policy, nonprofits, federal government, like what Christine does at Mitre. I mean, it's really all over the board. One person was talking about finding your niche. Christine was saying, stay a generalist because you can go in multiple directions. It's really about finding, in my view, finding what makes sense to you and what makes you feel comfortable. There's another question for Cordelia. What should I expect in an interview with the DC Child and Family Services Agency?
That's a great question. I started working there in 2000. I actually interned at DC Child and Family Services and then ended up being hired as a social worker there. So depending on what position you apply for, it'll roughly be a panel interview, probably with 3 to 5 other employers, management level, someone that may be your supervisor or a counterpart to someone who would supervise you, and potentially a program manager an administrator would be in the interview. I would say it would be around whatever role, like I said, around whatever role you're actually applying to. So at DC Child and Family Services, you could be a case carrying social worker. You could be working with youth who are still in the home. You could be a CPS worker. They do a really good job at posting on the website what the job entails. And so I would say to make sure once you are applying that your resume matches the similarities that are actually in the job description, and be elaborate on your questions in your application, your descriptive questions and answers. Be very elaborate on there so that you have a higher chance at your application and resume being pulled. And then to prepare for the actual interview, just know what the duties and the roles and the responsibilities are, and really show how you can bring your unique skill set and work ethic to support the agency's goals and missions.
Thanks. Okay. Question for Christine. What type of public health projects does Mitre work on?
So they actually work on a lot. They have a really growing public health set of projects. They have something called a health FFRDC. So most of their work was primarily with Centers for Medicare and Medicaid Services, but they've been expanding over the past 5 years to across HHS. So there's a lot. And right now, I support the Veterans Health Administration more at the enterprise level. So there's probably more on the HHS side. My group is a little bit smaller. I could go into specifics, but I think probably to answer your question, it's there's opioid misuse projects going on, other children's health program support. There's a lot in analytics also.
And is that information available on the Mitre website, or how do people figure out what Mitre is doing?
Yeah, it should be on the Mitre website. And signing up for job alerts to get at least once a week, I would definitely recommend that. I still get them. Because like I said, I'm in a small area, and it's, you get offered a position at Mitre, I would take it, and if you're interested in other areas, it's not a big deal to transfer down the road. So, you know, it's pretty typical for people to have a spaghetti career there. So, yeah.
Thank you, Christine. I'm going to get to some of our hands here. I'm just going in order in which they were received. So I see Ashley's hand raised. I'm going to go ahead and unmute you now.
Hi, this is just a question for the nurses that are on the panel about nursing. I know there's a couple of us on this call from the accelerated nursing program, and due to our new situation, most are not in the hospital anymore because all students have been removed from clinical, and then with the potential for us to not be able to also do our preceptorship in the summer. So how do you see that affecting our marketability? One, it's hard to network when you're not in the arena, and two, just losing that actual hands-on clinical experience obviously is very different from what we were expecting at this point. Do you have any thoughts on that, and how to counteract that? Or
You're not alone. This is a nationwide pandemic. So all of your, are you graduating in May or later?
So the accelerated program is graduating at the end of the summer.
Okay.
But it's just such a truncated program to begin with that you know, my clinical group was only in
just that it's accelerated, but please know that all the potential employers are aware of this. And if I know that you have simulation exercises and your faculty are probably providing other opportunities for you to learn, besides the fact that you need to be studying for NCLEX RN as your home and you're studying. The future employers know that you're going to need some blitz type activities that are going to review the skills necessary for you in that first position. You probably, if we don't get back to in hospital or in the sites, you're going to be hired as a graduate nurse. You will have a grace period in which to take your NCLEX RN because we're all getting backed up now because the testing centers are closed or they're opening up very slowly with only a limited number of people testing each time. So our December graduates are still testing now and trying to get into those new professional RN positions. So please know that the employers and all the states are aware of this condition. They don't expect you to know everything. And Chris might agree, your real learning begins in that first position anyway. You'll have an extensive orientation. You'll have a precepted or residency type thing where you'll be paired with a seasoned nurse to learn the role, to learn the unit where you're hired. So please try to study as much as you can right now, but relax about that clinical piece because you can't do anything about it. If some of our students are working as nurse assistants, they are still working. And of course, they're getting paid while they're working. They may not be working as nursing students, but they're working as nurse techs, nurse partners, whatever. So that could be an opportunity for you to see if there would be some kind of those positions available part-time to you to get in there and work as a nurse tech to get some experience. Chris, do you have anything to add?
Yeah, I was going to say a lot of employers, even as a nursing student who went through their preceptorship and went through all that clinical time, you show up on day one and they expect you to know nothing. So yes, you are at a quote unquote advantage having spent time in the clinical area, but they all know that they're starting with a blank slate. And every hospital has an integrated educational preceptorship program built in that will morph out of this, where you will spend time in the simulation lab. You will have to do reports. You will have to do a poster presentation. There's a lot of work that goes into being that nurse. You don't just show up and you're taking care of patients at the bedside. And they are never in a million years going to pair you up with or let you go on your own. You know, it's not a kick you out of the nest type thing. They are definitely going to pair you up with at least 2 extremely experienced nurses who know what they're doing, and will guide you throughout your interim process. So that is something that's already in place nationwide, and it's something that will evolve out of this. And I really don't think the impact, I know where you're coming from, because that's the whole point, is to get in the clinical area and to get that experience and really find out what you really love. But
Well, sorry, I also think I meant more along the lines of actually meeting people. Like you were saying, you met this guy and then later you got your job because you met him, and we're just not even there to be seen or met, which is so. How do you, I guess it's more, how do you expect, like, how should we network when we can't even step in the doors there,
you
basically?
still have a actually a tremendous opportunity to do that with your professors, because your professors are engaged in the nursing community, and that's ultimately how I got my break. And you know, as a Mason nursing student, you can kind of take comfort in knowing that 1 out of every 3 nurses in the Northern Virginia area graduated from George Mason University. They are well embedded in the community, and those opportunities are still there. You just have to work a little harder for it and reach out to your professors. And your work ethic will speak more for you than clinical time, because you can't teach work ethic, but you can teach clinical skills.
Okay, great. Thank you.
Thank you both for answering that question. Abdurrauf, you have your hand raised.
Hello?
Yes, we can hear you.
Okay. Yeah, I'm majoring in bioengineering. Um, yeah, I'm majoring in bioengineering, and I wanted to know how restricted I am in looking for a job or graduate program after I graduate with that major. And like, where do most bioengineering students do after their undergraduate degree?
Industry. Look at the need that we have in industry to make ventilators at this point in time. Every nurse could probably speak to you about some piece of equipment used in healthcare that we could use you bioengineers to review and improve upon. So healthcare systems, for sure, engineering, all of those huge companies that make those products for healthcare in general.
Mitre loves bioengineers. We are known for prototyping things, so please, keep an eye out, and yeah, we're happy. That's a great career right now.
And what about in terms of graduate programs? Like, where do most bioengineering students go to if they want to pursue the graduate program path?
Joanne, I think you're muted. I can't hear
It's
you.
unmuted.
What about now?
Yes, yes.
Okay. I would say go on for your PhD, try to get a faculty position if you like to share your knowledge with others. And I will tell you, we have a critical faculty shortage in nursing. So any of those sciences, subject areas that prepare nurses for practice, they would love to have you as well. So of course, I'm an educator, and I really appreciate the PhD on the academic side, but we have a shortage of faculty and people to get back into the university to teach our next generation of students. So that's a possibility.
Thank you, Joanne. All right, Abdurrauf, I'm going to lower your hand, and then Fatima, you have your hand raised. Let me go ahead and unmute you.
Hi, so I'm a sophomore at Mason, majoring in community health, going into the pre-physician's assistant track, and I'm mainly looking to kind of get clinical experience and shadowing experience, but obviously that is kind of not happening due to the pandemic and what's going on with everything right now. So I was wondering, what are some other ways to kind of gain that clinical experience while social distancing?
So one thing that I would do is, I mean, obviously, you know, being a sophomore, you probably haven't made the decision to where you want to go to PA school. But one thing you could do is reach out to several different PA programs and ask what their applicants are doing and ask what their students are doing. Especially given the current climate, they'd be more than happy to share this information with you because they want you as a student. So I would just kind of seek out those resources. Even, you know, asking for potential leads for, you know, active physician assistants right now and how they're handling the pandemic. I think that would be a good way to start.
Okay, great. Thank you so much. I appreciate it.
Great. I think we're going to turn it over back to typed questions now. Is that right, Caroline?
Correct. Thanks.
Great. Okay. So this question is, I'm transitioning from a clinical health career to health informatics, a master's degree, with no real informatics job experience. How do I promote myself for a position worthy of an advanced degree without the informatics job experience? So I would broaden the question and say, how do you transition from one career to another and utilize and talk about the skills that you gained in your old career and try to make them relevant to a new career?
Yeah, this is Christine. If there's any chance to get some sort of research experience, you know, even in a telework situation would be extremely valuable. I know for me, like we really do like to see people with research backgrounds and, you know, at varying levels. You don't have to be, you know, the PI or even the first author. Really just, you know, get involved in a couple different projects if possible. That would be my advice.
Thanks, Christine. All right. Is there any additional advice you can offer in looking for an internship or job in general? Cordelia. Oh, go on.
Okay, Cordelia.
I asked Cordelia because she mentioned that she had an internship that transitioned into a job. So can you talk a little bit about how you found that and how that all worked of the transition from internship to job?
Of course. So, of course, with your master's or undergrad degree in social work, you have to have a placement. And so my focus was children and families, and I was able to locate the internship in which I wanted. So typically there's a process where you select 3 and you're matched. And so I was matched with DC Child and Family Services. And throughout my time there, I did a bunch of what everyone else has spoken on, and I networked with other people. I would attend meetings and ask, you know, the participants what they did and what their job roles were, and I asked to shadow them. And so I just got a very I got exposed to a lot of different areas within the agency. And once it was time for me to transition and graduate, I was able to apply and network and, you know, get hired. So I think along with, you know, networking and your internships or your placements, you know, knowing people and showing them that you're interested in actually working for their company or whatever agency, nonprofit that you're interested in, just really showing interest and meeting some people on the management level that can kind of make those calls and those decisions for you. One thing that I also want to mention is sometimes we're in a position where I went to school with others that didn't necessarily enjoy their internship. So it was an opportunity where you may be in a position where you're learning what you aren't going to like in your career. And so take that as a learning opportunity, and figure out why you don't like that particular area. Because just like with nursing, social work is very broad. You can work with adults, you can work with children, you can do therapy, you can do community-based work, you can do policy. And so for me, I really enjoyed the internship and thought that I would continue to pursue that within my career.
Thanks. Cordelia, I have another question for you. How do you deal with your emotions with being a social worker? How do you not let your clients' burdens become yours?
Self-care is key. It's interesting because the position that I'm in right now, I meet with youth who are facing life challenges on a daily basis. Sometimes their basic needs aren't even being met, and I meet with them weekly. So taking time for myself, turning off work, making sure that I take some me time is super important. So whenever you're going into a field where you're helping other people, secondary trauma is a real thing, and you can begin to take on what you're doing at work. So just be aware of the type of stresses and triggers that you deal with on a daily basis, and implement a self-care plan so that you don't get burnt out super quickly in the beginning of your career.
Thanks.
And
Okay.
don't just make the plan, implement the plan.
Okay, I am going to ask this final question and I want everyone to answer it. Now I lost it. 1 second. Oh my gosh, I really lost this thing. So the question in general, I cannot find it right now. Oh, how did the panelists land their first job and did they like it? So Joanne, do you want to answer that question first? Well, think about when you first got out of school. How did you land your first job and did you like it?
I was in Mississippi. My husband was active duty Navy, so we were stationed on the Gulf Coast of Mississippi. And as I was doing clinicals, I was looking at those different institutions as a potential place to work. The hospital that I chose was the closest to my house. That's as simple as it is, because I thought, well, if I'm getting up at 5:30 in the morning, I'm going to choose the place that I don't have to drive an hour to get there. So that's what it was. I was pleased with all my clinical experiences, any of the hospitals, and I wanted med-surg as my first or basic foundational nursing experience to get the most technologies and the most pathophysiology, all of that. So ultimately, I could have worked at any of those hospitals on the Gulf Coast, but I chose the one closest to my house, and I was very well pleased.
Cordelia?
Yes, so I mentioned how I landed my first job after my career, which was through my internship and networking. Um, I kind of lost my train of thought. I was going to mention something about, repeat the question for me, please.
That means I have to find it again. How did you find your first job and did you like it?
Oh, yes. So my first job at DC Child and Family Services, I was a case carrying social worker. And one thing that I would encourage you all to also do when you're looking for jobs is to understand the structure of the entity or the agency that you're working for. So with DC CFSA, I could in my role or as a social worker, I could be in different areas of the agency. So I've held 3 different positions since being there for about 4 or 5 years. So I was a case carrying social worker, I worked in education, and now I'm a life set specialist. So I was able to do that because it's a larger agency and I could maneuver around. Whereas like if you're working for a smaller nonprofit, those type of options may not be available to you. So when you're doing your job search, just know the structure of the agency and know if you can have that flexibility if you're potentially in a role that you don't love, but there may be another opportunity for you to transition into another position. But I absolutely, I do love my job, and I love working with youth and helping them transition out of foster care.
Thanks. Chris, what about you? What was your first job?
So my first job, I worked in the emergency department at George Washington University Hospital in BC. I originally did my preceptorship at Inova Fairfax in the emergency department, and I thought that that's where I wanted to work right out of school. I met a lot of great nurses there, made a lot of great contacts, and what I kind of tell everybody is that the interview process is a lot like dating. You're really finding out exactly what you're going to like by deciding what you don't like. And when I interviewed for what I thought was going to be the job of my dreams at Fairfax Hospital in the ED, I met the senior director and was completely put off by them. They were rude. They didn't keep eye contact with me. They didn't listen to my responses or anything like that. And I was ultimately offered the position and turned it down because of that. So interviews work both ways. You know, you're telling them why you want to work there, but they also need to convince you why you should work there. And ultimately ended up in DC because one of the medics that I worked with at Inova remembered a very specific interaction with me and how he thought I went above and beyond to care for a patient. And he worked at GW and talked to his clinical director and got me the interview and the position.
Great, thanks.
I learned a lot there. It was a lot of fun.
Thanks. Christine?
Okay. Yeah, so I mean, everyone really covered almost most of it, to be honest. I mean, you know, just echo what everyone said, like, you know, you really do, you've put your energy and life into learning these skills and into school and, you know, these life experiences, and you really do have a lot to offer, and George Mason is a really great school. I will also share from something that was already discussed. You know, my VP came into my office randomly, and this is like an 8,000 employee like place, and he just does this sometimes, and he goes, you know, I just try and get to know the employees, and he's like, where did you go to school, this or that, and I said George Mason, and he goes, our favorite hiring school. So, you know, it really does have a good reputation, and just know, like, you know, just take advantage of the services available. You know, as someone who did not get a job, like I did not get my job from networking, like I did not know anyone. I applied to a lot of places, and you know, just know that it's probably around, you get around 10 interviews for every 10 positions you apply for, and then probably one job offer per 10, like 5 to 10 interviews, somewhere around there. So unless you have like the right contacts. So, you know, like what everyone's saying, network, but if that's not the option for you right now, you can get a very good job that you enjoy. I do like my job and my coworkers, and my employer is a great place to work. And I feel like, especially right now with this environment, they've really gone out of their way to take care of their employees. So you can do it. Good job.
Thanks, Christine. Thanks to all of our panelists. I'm going to turn it back over to Caroline.
Thank you so much. Those were wonderful closing remarks, Christine. I'm going to quickly just share my screen just to let you all know. We do have some more events coming up. Well, one more event coming up on Thursday. It's our Sustainability Careers event. It's still part of Health and Science Industry Week. You can find all their details on our website. I'd love to keep the conversation going. I know there were a couple of questions in the chat that we didn't have time to get to. If you do have more questions, feel free to email me. That's my email, cramir2@gmu.edu, and I can forward your questions over to our panelists so that we get those questions answered.
Can I add one closing remark?
Please.
We're talking about networking, but also finding a mentor is so very important, because if you find someone in your discipline who knows the discipline, knows the industry, they can guide you. At George Mason University, for me, that was Dr. Rita Carty in nursing. And the question she'd say, why don't you try this? And I'd say, I'm not ready. She said, yes, you are. So find a mentor who's very positive, who can guide you, but most importantly, support you and be the wind beneath your wings.
Thank you, Joanne. Yes, so important to find mentorships. Now is the time to be reaching out and developing some of those relationships. You may have noticed in our event description, everyone who attended today will be put into a raffle for a $100 gift card, just as an extra added bonus. But finally, to end the event, I'd like to thank our panelists. There's a little applause icon on the right-hand side of your screen where the raise your hand icon is, so you can give a virtual applause to our panelists. Thank you all very much. This concludes our event. Thank you all. Have a great night.
Thanks.
Good one.